My name is Rayna, and I just turned 25 years old a couple weeks ago. I'm located in the Seattle area, and my relationship with you, Victoria, is one that developed over health equity. We've done some volunteer events together, and we've worked on some initiatives together. I am an intern, so I've been working on some health equity initiatives within Providence Home and Community Care.
My name is Victoria Johnson. I am 27 years old. I'm in the greater Seattle area as well. I've had the immense pleasure of getting to know you over the last few months, which doesn't feel like a few months. I feel like every time I talk to you or hang out with you, it's meeting up with like a long lost friend or sister. Certainly helps that we share curly hair tips. It's a community effort. It really is. Being in health equity, do you mind speaking a little bit about what spoke to you about health equity?
I always tell people I did not intentionally step into health equity. It was a series of stumbles. Definitely feel like it was something that the universe or God kind of pushed me into. I initially, when I graduated high school, I was planning on going into dental hygiene. I had wanted to do some kind of trade school. I was not a college person at all. I thought too expensive. I was trying to be economical. I had been researching what's the most affordable school and then, the most you can make out of something. And so hygiene, that's where I was. I ended up doing an internship for a local private practice. Before you can get into hygiene school, you basically have to fulfill a certain amount of hours that you've worked as a dental assistant. So I went to dental assistant training, and then I went to work at a private practice. And while I was there, it ended up being a really poor experience. Essentially, I had to leave. I looked around in the same area for anywhere that I could finish my hourly requirement for dental assistant hours. I found a local community health center. And at that point in my life, I think I was 19 years old, I had absolutely no idea what community health centers were. I had no experience with them. I had really no interest in health equity or anything like that at the time. I hadn't really been exposed to communities that were really needing access to care. Living in the Seattle area, there's a lot of, I don't know how to put this. The Seattle area, in some areas, especially further up north where I live, is not very diverse. You don't see people of lower income. So I was really sheltered. So I began work for this community health center. And when I was there, I saw patients who did not have any means of accessing care, desperately needed help, and my heart was just burst open. So I started diving into all these different community health projects that the organization was working on. I was a dental assistant. I just did air quotes. I was a dental assistant, but I was always working with administration on different health initiatives. We had a drive that we did trying to get young children in for their well child checks that were in impoverished areas. I was totally gung-ho passionate about that. After doing that for a couple years, I thought, if I really want to better serve underserved communities, I should probably get an education. I applied to UW's public health program. So in 2019, my junior year of college, COVID hit, and that was a big reckoning for me when it came to how I viewed access to care specifically for BIPOC individuals. And I needed to look for an internship. And so when January rolled around, I was specifically looking for health equity internships where I could have some sort of influence advocating for BIPOC communities. And I ended up seeing the listing for Providence and applied for that. And then here I am. I found myself a lot more interested in providing the access to care than actually providing the care itself. So that's kind of what dragged me out from dental hygiene into public health.